Yeah, I'm Hannes Smarason. I'm here to talk to you about how genomics is transforming cancer care. One of the first questions that you might be wondering is why cancer? And there are at least three good reasons as to why cancer lends itself to genomics. The first one is that, of course, it's a very serious disease. Secondly, early intervention makes a big difference. If you identify a cancer early, you can potentially address it with much greater likelihood of success than you otherwise might be able to undertake. The third aspect is the vast body of knowledge about the disease, about the role of genetics in the disease and so forth that we have to work with. So those are some of the reasons why cancer lends itself naturally to be treated or where treatment could be modified using genomic technology. And there are at least two separate aspects to using genomics in transforming cancer care. The first aspect is what we might call DNA analysis on germline DNA. In other words, helping you to understand why you have the propensity or the risk to develop certain types of cancer, be they breast cancer, prostate cancer, or colon cancer, for example. We have recently seen a very high-profile use of such a genetic test in the case of Angelina Jolie, where she ended up being tested for the BRCA gene, and upon discovering that she held a devastating mutation, actually undertook some very drastic actions to try to modify her outlook in terms of the risks that she might actually develop the disease. So that's an example of how you can use germline DNA analysis to help elucidate what your risk profile and your at-risk situation is in the case of a given cancer. The second aspect of using genomics and sequencing in particular to transform cancer care has to do with tumor sequencing. If you sequence a tumor of an individual, you can begin to understand the specific genes that are at play in the individual tumor. And it has been demonstrated now that based on the particular genes at work in the tumor that you are having, you can both treat those tumors with different drugs and with different methods with a much greater likelihood of success than you others would be able to do. So both on the front end, in other words, helping you to understand the risk of getting a particular cancer, but also on the back end in terms of how you actually treat that cancer, how you treat that particular tumor that you might develop. Sequencing can be absolutely critical in terms of revolutionizing and transforming how we treat this debilitating disease.